Greetings. If you know you are pregnant and you have preeclampsia, you have hypertension in pregnancy or a pregnancy-induced hypertension, this video is for you. Listen to me. Before I continue, please, I want to beg you I to subscribe to my YouTube channel using the link in my bio. And the name of my YouTube channel is showing on your screen is Nigerian Health TV. Go to my YouTube channel and subscribe. And thank you. Now back to the topic. How do you cope with preeclampsia? Some women have had repeated stillbirth, miscarriage, eh, from preeclampsia. And sometimes, and when they get pregnant again, they don't know how to go about it. They don't know how to go about it. They get confused. So I want to educate you on how to cope with preeclampsia. One, make sure that you register on time. Immediately you take in that story of waiting for 3 months or 4 months before you register. No, immediately you take in, you go and register for antenatal so that you'll be under the direct supervision of a doctor. And I will also beg you, if you are a woman and you once had preeclampsia and it was very turbulent for you, it was very turbulent for you, right? What you will do is, when you get pregnant again, that's not the time for you to be going back to the primary healthcare center where you used to be, where there is no doctor. You need to be under the direct supervision of a doctor if you have preeclampsia. So what you need to do is to go to a bigger center. If you once were in a general hospital, eh, or you were going to a primary healthcare center, go to a general hospital. At least they will have an obstetrician and a gynecologist there and trained midwife that can talk to you, right? Or you go to a private hospital where you know that the doctor is always on ground. It must not be a gynecologist, but just be in contact with a doctor. The doctor knows what to do. A place where there is a trained midwife, experienced midwife. That's not the time for you to be going to traditional birth attendants. Preeclampsia is not a joke. It has killed a lot of women. It has maimed a lot of women. It has made a lot of women go blind. It has caused a lot of stillbirths, birth defects, eh? Seizures. So you have to be careful. You should learn from experience, learn from the experience of everybody. I'm just trying to advise you on how to cope with preeclampsia. I'm not scaring you. I'm trying to make you have an open mind. I've said leave the center it used to be. If it's a center where there was no doctor, you maybe when you were the last pregnancy, when you had preeclampsia, when you were pregnant, you were hardly seeing a doctor. There was no nurse, trained nurse on ground. The next thing, when you are pregnant this time, go and register in I will even prefer a teaching hospital. Go and register in a teaching hospital or a federal medical center where you have consultants and specialists. That's that. Number three, after that, make sure you take your drugs. Make sure you take your drugs. Don't fate it. Don't fate it. Don't fate anything. Hmm? Be hopeful. Have positive mind. What I mean by don't fate it is some of you start fating it and stop taking your drugs. Eh? God is not an author of confusion. You know, you stop taking your drug, and God is the author of all knowledge. So don't do past yourself. Don't start looking for what is not looking for you or looking for miracle centers. Go to a hospital. The medications they prescribe for you, the medications they prescribe for you, make sure you are taking them, you are buying them. Don't skip anyone. Eh? Some of the medications they will prescribe for you are metidopa or adomet, labetalol. I'm not saying you should go and start taking them by yourself or let a doctor prescribe for you and tell you how to take them. Then there's magnesium sulfate that will help prevent seizures. Then there is vasoprene. Vasoprene has been found to help, that is low dose aspirin, has been found to help women with preeclampsia. You make sure you take your drugs. Another thing you need to do is to reduce stress. Reduce stress. Anything that will stress you during that period, that will make your BP go up, that will make you talk too much, avoid it. Avoid it. Avoid it totally. Right? Avoid it totally. Don't stress yourself. Don't have any issue with anybody. Let you also sit your husband down. Let's say, Oga, my hobby, please. I don't want us to quarrel this period. I don't want anything that will make my BP go up. I don't want to have any trouble. Please don't have any trouble with me. And a responsible man will understand, right? Now, that's what you should do. Anything that will stress you. And if possible, after you have registered in that big center, After you have registered in that big center, it is also good for you to also you can register in two places. So, okay, no, you can register in two hospitals, and they will not be in conflict with each other. In case there is an emergency, when you need to go to that big center, it's very far. Like you are staying, if you are in Lagos, you are in Ikorodu, and your hospital is in did I say Ikorodu now or Badagry, and you registered in Lut. You know that's quite far, right? That's far, or Lasut. Those places are quite far from Badagry. So you need to register in the nearby. Lagos have some very standard general hospital, modern child centers where people deliver. I like that's the truth. So you can register in any of these modern child centers where, in case of emergency, you can run there. It's nearby. You can go there. Especially if something happens at night, you can run there. You understand? So register in at least two centers, at most two centers. You can also have personal doctors that will help you to always respond to you when you have a question. And that's how people do it. And when you have preeclampsia or you have gestational diabetes, all these diseases in pregnancy that poses risk to you and your baby, you can have personal doctors. You can have a doctor that you have the WhatsApp number. You can always ask questions. I'm feeling this way. What do I do? The doctor will tell you, oh, this is an emergency. Go to the hospital now. You understand? Women do it and it turns out successful. I'm just telling you how to cope with preeclampsia, right? It turns out successful for them. They will give birth normally. They'll be happy. Take your drugs, eat. Then another thing is that you can do minor exercises. Walk around your house. Eh? I'm not saying stress yourself. Walk around your house. Do some sit-ups, right? Do some sit-ups and let people help you. Let people help you. Eat, drink water, eat fruits like watermelon. Eh? Fruit like watermelon will help you in preeclampsia. Eat fruit because watermelon contains a lot of nitric oxide that helps dilate the blood vessels so that blood can flow very well. Eat fruit like watermelon, right? Another thing, another way to cope with preeclampsia is to do you will do plenty scan. If you notice there is any problem, your baby used to kick and baby is not kicking very well again, you feel you go and do a scan. You go and do a scan. Hmm? You go and do a scan. Another, you go and do a scan to check the well-being of the baby. Another thing you need to do is this: have an open mind. If you have preeclampsia, it is an indication for CS, straight CS. So have an open mind that I'm going to have CS. Have an open mind. See, you will know me by now that I'm very practical. I don't like beating about the bush. Have an open mind. This is preeclampsia, and most likely I'm going to deliver through CS. Have an open mind so that you now start causing trouble when it's now time for you to deliver. You are now still, should I do? No, have an open mind. Preeclampsia, go and check it. It's an indication for CS. Eh? Have an open mind. Take your drugs. Eh? Have direct contact with your doctors, your nurses. Eh? Your hospital should be close to you. Be happy. Be happy. Eh? If there's any problem, you talk, you speak out. Take your routine antenatal medications. Take your folic acid. Take your folic acid. And also know that sometimes when you have preeclampsia, your pregnancy may not get to 37 weeks. Because once your doctor notices that the pregnancy is posing risk to you, that baby CS will have to be done for you, and the baby will have to be brought out to be put in incubator. Because the number one rule for now in Nigeria is that you must save the mother first. Eh? When there is a risk to the baby and the mother must be saved first. Ask any doctor, they will tell you. Eh? So have an open mind. Eh? Know that this pregnancy may not get to 37 weeks or may not get to maturity. Have an open mind. And when it's getting close to when you will deliver, there's a drug that will be given to you that will help the lungs of your baby mature. I don't want to mention it here. Your doctor knows the drug. Show it to this to any doctor. He knows what I'm talking about. Or she. Thank you very much. I know that if you follow this rule, you are going to deliver safely. You are going to have your baby. Preeclampsia got nothing on you. Preeclampsia got nothing on you. You can cope with it. Thank you. Please don't forget to subscribe to my YouTube channel using the link in my bio. And the name of my YouTube channel is Nigeria Health TV. Bye-bye.